My name is Jeremy Peterson. I'm a chiropractic doctor. What we do is we treat all patients without surgery and drugs. What that means is if our average patient will come in with neck pain, back pain, shoulder pain, knee pain, and we diagnose them, decide if they need advanced imaging, MRIs, PET scans, CAT scans, x-rays, or if it's something we can handle. If it's a surgical case, we refer out to an orthopedic or neurosurgeon depending on what the issue is. If it's a non-surgical case, we will use soft tissue therapies, chiropractic adjustments, rehabilitation, cold lasers, ultrasound, etc. to calm down the injured area, rehabilitate the tissue, restore normal movement to the joint, and then strengthen it back up so that they're pain-free and more functional to avoid future injuries. There's not substitutes that have the same training, but similar training were doctors of osteopath. Maybe 20, 30, 40 years ago, they used to get a lot of training, different types of adjustments, but the same general philosophy. They could diagnose a patient, adjust them, do soft tissue work, rehabilitation if they needed to. Very few osteopathic doctors do that anymore because they've been absorbed by mainstream medicine. They're more or less normal medical doctors that prescribe, do surgery, or refer out for rehabilitation now. We don't accept Medicare. Reason being is Medicare discriminates greatly against our field. They don't pay for the initial examination or images. That's all out of pocket for the patient. So there's no real benefit for the patient. So we will give the patient the paperwork, let them submit it to the federal government and collect a small reimbursement for our actual treatments, but we have them pay up front. Otherwise, we accept all major medical insurance. The requirements are fairly simple. They're changing, but as of right now, it's 90 hours of undergraduate training at any nationally accredited school with all the hard sciences you would need to get into any higher medical training, which would be all your general chemistry, organic chemistry, physics. In the very near future in Texas, I don't know if it's next year or the year after, you're going to have to be required to have a bachelor's degree. That should have happened a long time ago, and it didn't. So as of now, you can be a junior and take all the courses and go right into chiropractic college. And it's a 3.5 year or 10 semester course.